Let's have Olivia come down to the ground. She's gonna be laying in a prone position. One hand or two hands can be supporting her head. This is our half frog position. One leg will be straight. The other leg will be out to the side here. Now, to determine how high this leg's gonna go, we wanna make sure that the pelvis is able to stay square to the ground. So if you're lifting your leg up and you're getting into a hip hiked position, this is where you're gonna bring that leg lower down until the pelvis is basically square to the ground. Low back is gonna be long. We wanna make sure that you're not gonna be driving into your low back. So let's get into what we call a posterior pelvic tilt. So you're gonna tuck your tailbone under, flattening your low back, protecting it as you're in this position. So our focus is going to be hip internal rotation to test to see where your end range is, the leg that's out to the side, maintaining those cues that I just described. I want you to think about rotating your thigh bone forwards as you try to lift your foot to the ground. So Olivia has some nice IR. She obviously can lift her leg off the ground pretty high. So I'm going to fill the gap for her so that she is at her end range. There we go. Now make sure when you fill the gap, you don't lose the low back and the pelvis position. So when we target our hip internal rotation pails and rails, we want to make sure first that we are not compensating elsewhere, as well as we want to hold the stretch for 2 minutes. Reason we want to hold the stretch for 2 minutes is it takes time for the body to allow the higher tissues, the more superficial tissues to relax and allow that actual stretch to get deeper down into the hip capsule. The hip capsule has a lot of nerve endings, and that's what we're really trying to target with our pails and rails here. So our pails, just a review, is going to be us using the tissue that is closest to the surface of the ground. We're going to be trying to contract that tissue, and we're going to try to bring that foot down into the ground. So your thigh bone is going to be trying to rotate into what we call external rotation. So thigh bone is going to rotate this way. Our rails contraction after about 20 seconds of our pails is going to be the reverse. So the tissue on the outside is going to be the contractile tissue, and we're going to try to use all of that tissue all the way up to the hip bone, and we're going to try to rotate the thigh bone forward and down towards the ground, possibly lifting our ankle. So if you're not already, let's get you down into this position. Remember, we want to protect our low back, so our tailbone is going to be tucked under. It's going to flatten our low back. We want to make sure our pelvis is square to the ground, and then do your test to see where your hip IR actually is. Great, so everyone's down in this position. For the purpose of the video here, because we have lots of stuff that we want to teach you about, and we're not going to hold for that full 2 minutes today. We will most likely in our next position of froggy hold a little bit longer because it's easier to get into. So let's take you through a round of pails and rails here. So pails contraction. Let's have everyone start ramping up their contraction using the tissue on the inside of the leg. Start bringing that foot down into the yoga blocks. Thigh bone is rotating away from the ground into hip external rotation, 20% effort. Ramp it up to 40, 60, 80, 100% effort for 5, 4, 3, 2, 1, and the reverse, moving into our rails. Think about the tissue that's on the outside of the leg facing the ceiling is contracting, trying to rotate the thigh bone forward and down towards the ground, lifting the foot up towards the ceiling. Rotate, lift for 5, 4, 3, 2, 1. Stay in this position, but relax the contraction. Good. So pails and rails hitting our hip internal rotation, and we're also favoring this hip abducted position.